A slide with the WDBTAP logo on it reads Deafblindness in Children. Jen Gettleman, deafblind consultant, appears on the screen. The presenter and the interpreter appear in the right-hand corner.
Hi, everyone. My name is Jen Gettleman. I am the deafblind consultant on the WDBTAP, the Wisconsin Deafblind Technical Assistance Project, and the Outreach Deaf and Hard of Hearing team. I am going to be presenting on just a little bit of information about deafblindness in children. I want you just to take a minute and think about, what do you think of when you hear the term deafblindness? And I'm actually going to ask you to pause this for a minute and go to this Padlet and just put down your thoughts. I am going to just show this video quickly. This is a video of different students in Wisconsin who are deafblind.
I am deafblind.
I am deafblind. I'm deafblind.
I'm deafblind.
Many people think of Helen Keller when they hear the word deafblind. Helen Keller had no access to auditory or visual information, but only 1% of students nationwide have no auditory or visual access like Helen Keller. As you see from this video, children who are deafblind have varying levels of access to both their vision and to their hearing. Some students who are deafblind wear glasses, some do not. Some can see only in parts of their visual field. Some are not able to see at all. And some have a condition where their eyes work, but their brain doesn't process what they're seeing. Individuals who are deafblind also vary in their methods of communication. Some use sign language, some use their voice, some use Braille, some use a communication device, and some use a tactile form of communication. Many of the deafblind children in Wisconsin use a combination of any of these. Each individual with deafblindness is truly unique in their needs for access and for the strategies that work best for them. So what is the definition of deafblindness? It is important to note that the Wisconsin Department of Public Instruction proposed a rule change to include deafblind as a disability category last year. This new category did go into effect this August 1st, 2021. This on the screen is the Wisconsin definition of deafblindness. And what this means is that a child is considered deafblind when they have both hearing and visual impairment that's co-occurring. That this combination causes significant needs in the areas of communication, development, and education. And these needs are not able to be met in just a traditional deaf and hard of hearing classroom or a traditional blind and visually impaired classroom. Really, being deafblind means that an individual does not have enough usable vision to make up for his or her lack of hearing, while also not having enough hearing to make up for his or her lack of vision. It's also really important to understand that deafblindness is not deaf plus blind, but it is really deaf times blind. When you look at accommodations that a child might need, and accommodations that might be typically used with a student who is deaf, that's not going to necessarily work for a child who's deafblind, because those strategies typically require access to vision. And the same holds true for accommodations that are typically used with children who have low vision or who are blind. Those strategies may not work with a child who's deafblind. So these are two resources that we use when looking at whether or not a student might be eligible for services and support through the Wisconsin Deafblind Technical Assistance Project. This first one is a chart, and it goes through the different degrees of vision loss, which are across the top, and then the degrees of hearing loss. In this first section, we really just recommend that you consult with the Wisconsin Deafblind Technical Assistance Project just to see whether or not this child might benefit and be eligible to be included in WDBTAP. They might be at risk, and so that's just why it's important to reach out to us. The second one, students are eligible in this area. And again, we just ask that you reach out to us and connect with us, and we are happy to help support you moving forward. And then this third section is talking about cortical visual impairment. And so cortical visual impairment, for if you don't know, is a visual processing disorder. So the eyeballs can see, but the brain isn't able to process that information that they're seeing. And so oftentimes children who have CVI also have the same sort of component to their auditory input. And so it is really fair to assume that if a child has CVI, they may also have that auditory piece where they their ears are working and the sound can be heard, but that information just isn't being processed by the brain. When you are working with a student who has CVI, it really is important that the team continues to come up with strategies that work to kind of bypass that vision and hearing and include a tactile component, but also a multimodality approach that would include hearing and vision and other modes to communicate with the child. It is important to just kind of know that when you identify a child as being deafblind through WDBTAP, it does not change the services on a child's IEP. That would be done through qualifying a student through the IEP process and going through a comprehensive evaluation. However, when you identify a student on WDBTAP's registry, it does allow WDBTAP to support the child, to support the family, and to support you as the service provider. Things that we are able to support school teams with, we do have a pretty extensive lending library, and those items in that library are able to be checked out for a period of time to be used with the child. We have books and technology and equipment, a variety of things that can be checked out. And we are always looking for suggestions of items that might be useful to add to our lending library. So if there's something that your team really wants to try with this student, definitely reach out to us and we'll see if it's something that we could maybe purchase and add to our lending library. Along with that, we also do consultations where we work with the school team and the family to try to just provide that support and those discussions with the team. We also offer trainings for professionals as well as family trainings. We do those both virtual and in person. We provide some family events online right now for students and families to join that are just fun, where they're able to connect with other deafblind individuals. And then we also help to provide technology for distance communication for students to use at home through the I Can Connect program. And these are just a few of the resources that families and school teams can benefit from. So if you have a student that you are considering might have that combined vision and hearing loss, please feel free to reach out and connect with us. Additionally, there is a link on this slide, and it's also on the resource slide later on in the presentation, but there is also the checklist to consider WDBTAP supports. And so this tool that's linked includes things like medical history factors that might indicate a higher risk for deafblindness. It also includes behavior and other indicators of functional hearing loss and functional vision loss. So our suggestion, again, is just really that if you're questioning whether a child might be deafblind, please reach out to us and we would be happy to help answer questions, provide resources and support while the team gathers additional information. This slide refers to when an IEP team is considering the disability category of deafblindness for a student. And just to really emphasize, a child can meet this criteria in different ways. So the first way is that a child meets the criteria for both deaf and hard of hearing and blind and visually impaired. The second way is to meet eligibility criteria for either deaf or hard of hearing or blind and visually impaired. And although they don't meet the criteria for the other disability category, they do have a documented hearing and vision loss. So for example, you might have a child who met the deaf and hard of hearing criteria for Wisconsin, and then that child has a documented clinical or functional vision loss. Or you might have a child who has met the blind and visually impaired criteria and has a documented functional or clinical hearing loss. Or a child might have a documented medical diagnosis of a progressive medical condition that may potentially result in that combined vision and hearing loss, and that without that special education intervention will adversely affect the student's educational performance. So an example of this would be Usher syndrome. Many times with Usher syndrome, a child will be either deaf and then progressively lose their vision, or they'll be blind and progressively lose their hearing. And so this would qualify a student with the state disability category criteria for deafblindness. Along with this, the team also has to identify how the combined losses impact a child's education. So specifically, they need to look at communication, development, and the developmental performance, and then academic performance. And we will go into those a little bit more in depth later on in this presentation. Right now, I just wanted to discuss a little bit more about the characteristics of a functional vision loss. And just keep in mind, these are just some. This is not an all-inclusive list, but some of the things you might notice is there might be abnormal appearance of the eyes. So for example, eye alignment. the eyes might not look in the same direction. One of the eyes might look like it's turned out or it's turned in. A child might have unusual eye movements. There might just be visible irregularities of the eye. You might see a child who tears up a lot or has redness of the eye or the eyelid. There might be absence of a clear black pupil. Or the pupil might be excessively large or really, really small. Then there's also behaviors that you might see in a child with a functional vision loss. So they might have an unusual gaze. They might look with from the bottom of their eyes. They might look at and put their eyes up. They might look out the side of their eyes. They might have an unusual head position. So they might turn their head to see better. Another thing you might notice is that a child might not look at faces, or it doesn't look like they're looking at you. They might not have interest in visual materials. So they just might not want to look at things the same way as other children are looking at things. You might notice a child is squinting, or their eyes are tearing, or they're frequently closing their eyes or even pushing on their eyes a little bit. Additionally, they might turn away from light. That light might just be too much for them. And they might have difficulty adapting to changes in lighting. So when you think of kids at school, a lot of times when they come in from recess, it's a darker lighting environment. And that change might be hard, or vice versa. When they go outside from that darker environment to that really bright environment, they might not be able to see as well. And it might take them a longer time to adjust than another child. And that child might strain or appear to not see well in dim light. Additionally, they might poke or press or rub their eyes a lot. They might be holding an object, but they're not really looking at that object. They're not looking at the different characteristics or features of that object. They might hold materials close to their face, or even at a different angle than what you would typically expect. Additionally, if an object the child is looking at is moved, the child might not follow or track that object. They just continue to kind of look in the direction they were looking. Or they track it, but it's just not done as effectively or as efficiently as you would expect it to be. Also, children might have poor reaching behaviors. So they might reach for something and they might reach too far, or they reach not far enough. So they often are missing that object and almost have to tactily try to find it. And then there's also the absence of visually directed behaviors appropriate for their age. You might see a child look at an object, look away, and then reach for that object. That would be an example of a type of visually directed behavior that wouldn't be expected for a child. Additionally, I want to share the characteristics of a functional hearing loss. There are possibly abnormal appearance of the ears and associated structures. So for example, a child might have a cleft lip or a cleft palate. They might have malformations of the head, neck, or their ears. If a child has frequent ear aches or ear infections, this could be a cause for concern as well. Or if you see discharge from a child's ear, that's important to note. Some of the behaviors that you might see with a functional hearing loss, a child might make few or inconsistent responses to sound. They may respond more consistently to familiar voices than unfamiliar voices. So for example, they might respond to mom better than they would respond to maybe a newer staff person working with them at school, or a doctor, or someone they're not as familiar with. The child might show a preference for certain types of sounds. So for example, they might like higher pitch sounds, or lower pitch sounds, or even sounds that are more musical in nature. They might not try to imitate, or they might have limited vocalizations. Children with a functional hearing loss might have a preference for toys that have an auditory or a musical component to them. They might startle to new or unfamiliar sounds in the environment. And in addition to that, they may not habituate to sounds in their environment. So for example, a child who is at school every day, at 3:30 in the afternoon, that bell rings every day to say school is done. And every day at 3:30, that child startles and can't anticipate that that's the bell ringing to tell them to go home. Another characteristic of a functional hearing loss, they might have a hard time attending to auditory stimuli for a reasonable length of time for their age and their developmental level. Also, they may have differences in their voice quality, their pitch patterns, or even just the speech sounds that they make. They may not turn to or attend to voices or sounds in their environment, even if they're directed right to them. They may have difficulty localizing sounds. So if there's someone talking to them, maybe in a different part of the room or even in a different room, they're not able to figure out where that person is. And so that would be that localization of sound. You might notice that a child pulls on their ears, or they're covering their ears a lot. They're real sensitive to that sound. You also might notice a child like kind of angles their head to one side to try to hear better out of the other ear. You might see or hear a child say huh or what frequently, or what did you say? Did you say? And then repeat your message, and it might be a correct message and it might be not exactly what you said. You might see that they're misunderstanding directions or questions, or that when those directions or instructions are given, that they're watching other students to try to understand what they're supposed to do. So when we think of the five senses, vision and hearing are the primary senses that we use to collect information. Learning and development typically happen as children use their vision and their hearing to interact with people and the world that's around them. Vision really helps us to build concepts. It helps us to develop those social relationships. We can watch other people interacting with others. We can watch them communicating with others and learn about turn taking or about just social appropriate cues. As much as 80% of what we learn is actually done visually. And if you have a student who is dependent on sign language, that increases because now their communication is done visually as well. And children really do learn from watching other people. They learn through observing objects and through actions. And then when we think about hearing, for most people, hearing is the basis of language and communication. Hearing is also used to develop relationships. We use our vision for auditory confirmation. So for example, if you hear a noise, let's say you hear a big bang outside. What you'll do is you might look outside to then try to see if what you heard matches what you see. And so, if you think about like a big bang and it's the garbage truck, you might have heard that, and then you're looking to confirm that that's actually what happened. Deaf-blind children often are not able to do this. So when these two channels and these major channels for receiving information are not functioning effectively or efficiently, the effects on a child's development can be far-reaching. Areas of the development that can be impacted include communication and language development, developmental performance, and educational performance, both academic and non-academic. And it's important to remember that the world of a child who is deafblind is limited to what that child can gather through the use of their other senses, particularly touch. And then also using any vision and hearing that they do have to gather that information. So the more severe a child's deafblindness is, the narrower the world from which they can learn from. And the more important the sense of touch becomes. So it's just really important to understand how a child's vision and hearing impact their development and how their specific loss of vision and hearing impacts them, so that those accommodations can be put into place to just help that child expand their learning to the world beyond just what they can touch and what's within their reach. When thinking about communication, individuals with a combined hearing and vision loss often can't rely on their vision to access auditory information, and they're not able to rely on their hearing to access visual information. Language and communication are both learned incidentally, and children who are deafblind don't have complete access to this incidental learning. So this includes things like conversational cues, facial expressions, gestures, body language. All of those things might be missed and have to be directly taught or provided in a different way for that child to even know they're happening. So for example, a child who uses their hearing and is deafblind might miss different sounds for morphological markers. So the letter S, so that sounds might be difficult for them to hear. So if you're talking about cat and you add that S on, they might miss that S and not understand that you're talking about more than one cat. If they use sign language, they might be missing those grammar pieces that are portrayed on the communication partner's face. So if a child has a vision loss and they're looking at your hands, they might not be able to see both your hands and your face at the same time. Something else that can be very challenging for children is classroom discussions. So if that child is in a classroom where there's a classroom discussion happening, and there's that back and forth between the students and the teacher, that child who's deafblind might have a hard time following that conversation. So, it's a student A's turn, and now this deafblind child is trying to figure out who's talking. And by the time they get to student A, student B is now responding. So they've now just missed all of that information that student A shared. And so just being cognizant of that with a child who's deafblind and trying to facilitate some of those strategies that might help with those classroom discussions would be very helpful. Many children who are deafblind also require a tactile component to accessing communication. So this tactile component, or this, a strategy that they might use would even just be like a physical tap to get that deafblind individual's attention to say, I'm ready to communicate with you, so that they know that they're looking at you, or they're having that conversation and who they're having that conversation with. It also might include tactile sign language. It might include haptics, or even tactile symbols. So each child is really unique in the different strategies that they need and that they use to be successful and to have access. In considering the impact on developmental performance, deafblindness might affect a child's ability to learn and to problem solve. Concept development is a big one. Often the concepts that we learn are done through incidental learning. And incidental learning is typically not fully accessible to a child who's deafblind. Concepts could include things like how a conversation works and that turn taking. It could include things like where an egg comes from before we eat it. A concept might be like, what does it mean to wash your hands? There are so many concepts that children need to learn and to build. And for children who are deafblind, these concepts need to be taught in a very direct, intentional manner. Another impact on developmental performance could be understanding and using language, reading, communicating, interacting with others. So that social interaction, they might not be socially appropriate. They might not understand or use social cues. Sometimes individuals with deafblindness might have challenges when it comes to self-control or emotional regulation. And this can really be a challenge. And it's really important to teach children the strategies to have that self-control or have that emotional regulation, and then reteach. And it's super important that that's done not just in the moment, but also when the child is calm and ready to learn and ready to practice that, as well as revisiting it after maybe the child has lost control, just to reteach that and to have a conversation about what could happen a little bit better next time. Additionally, fine motor and gross motor could be impacted. Their sensory awareness. And an individual with deafblindness may not have a good sense of body image or of a self-concept and understanding of themselves. The third area that we look to see if deafblindness is impacting a child is educational performance. That can include academic achievement, which would be things like grades or standardized testing. And it also can include non-academic achievement. For example, functional performance, social and emotional development. It's really important for children who are deafblind to look at them through a lens that considers their social emotional well-being and their social skills. So oftentimes children with deafblindness benefit from that direct instruction around social skills, as they're not able to incidentally learn that information due to their combined hearing and vision losses and not being able to see or to hear those social interactions of their peers. Another area could be behavior. Executive functioning skills is often an area that needs to be explicitly taught and practiced as well. Transition skills and independent living skills also should be taught, and those should be taught starting at an earlier age, just due to that lack of access to that incidental learning, as well as that need for that hands-on real experience. And that hands-on real experience often takes a longer time than just incidentally learning it or being able to directly be taught it and just talk about it. So this instruction really needs to be done in a very direct and purposeful manner. Additionally, self-help skills should be considered in there as well. Are there any questions? I would just like to ask that you take a few minutes, and if you have some questions, just go to the Padlet and just put them down. I would like to ask that if you add a question, that you just add one question on each note. So if you have 5 questions, just add each question individually on 5 different notes. And here are some resources that I wanted to share with you or that are throughout the video. I will also put these in the YouTube description so that they're more easily accessible for you. So the first one is just the Wisconsin Deafblind Technical Assistance Project website. The second one is a short video that just kind of explains different supports and services that WDBTAP can provide to families and to school teams. The third one is the DPI. It's the new DPI Deafblind webpage. On here is the new criteria for the deafblind disability category. Then there's also the eligibility chart, and then the checklist for considering WDBTAP supports and services, as well as my contact information. Please feel free at any point to reach out to me if you have any questions about anything related to deafblind. I am happy to have a conversation and to try to support you in the student that you're working with.
The logo is displayed for the WESP-DHH Wisconsin Deaf-Blind Technical Assistance Project, WDBTAP. The logo for the Ideas That Work is displayed and reads, "The contents of this presentation were developed under a grant from the U.S. Department of Education, H326T180044. However, those contents do not necessarily represent the policy of the U.S. Department of Education, and you should not assume endorsement by the federal government."